Welcome registered nurses to be. In this first video of the series, I'm going to introduce you to standardized nursing languages. Some of you might be here because I directed you to this video. Others might have happened upon the video. However you got here, welcome, and I hope you leave informed. I will begin by first outlining the use of nursing documentation. Next, I'll move into the definition of standardized nursing languages, and I expect that you'll be able to define it in your own words and give at least 3 examples of a standardized nursing language. You should also be able to explain at least two reasons why standardized nursing languages are important. I've broken this topic down into several parts, so watch the other videos for content related to the other objectives for this topic. On a continuous basis, nurses document their assessment of their patients and the nursing diagnosis they formulated for these patients. Nurses also document the outcomes they want for the patient. They also document the actions they carry out, whether independently or in collaboration with other healthcare professionals. And nurses also document the patient's response to these actions. Keep these areas in mind because as we discuss the various standardized nursing languages, we will talk about how these standardized nursing languages will help nurses to document each area listed here. Did you know that in the absence of nursing data, nursing care was often measured in negative qualities such as adverse events? These adverse events were called outcomes potentially specific to nursing. Sewell defines them as medical diagnoses that may measure the contribution of nurses in providing care. These outcomes potentially specific to nurses are negative health consequences which arise from inadequate nursing presence with the patient and include urinary tract infections, pressure ulcers, pneumonia, and patient falls. The United States Department of Health and Human Services studied data from 5 million patient discharges, and the results of that study demonstrated that more registered nurses resulted in fewer occurrences of these outcomes potentially specific to nursing. If you look carefully at the outcomes potentially specific to nursing, you will notice that they represent negative consequences of inadequate nursing contact with the patient. The data have shown us that bad things happen when nurses are not with the patients enough, but the data does not demonstrate how nursing care positively contributes to good patient outcomes. Do not develop urinary tract infections. What does the nurse do to cause that to happen? When patients who are at risk for falling do not fall, what does the nurse do to prevent that from happening? Those are only a few of the very important questions that can be answered by using the data in nursing documentation. Nursing data documented throughout the period of the patient's admission can be a very powerful tool to measure patient outcomes, both positive and negative. It is useful for communicating information on the patient's status throughout their admission. Nurse researchers can use nursing documentation to study the impact of nursing care on patient outcomes and to create new knowledge by showing how traditional practices impact patient outcomes. In order to unlock the potential that nursing documentation has, nursing documentation needs to be retrievable, comparable across settings, and measurable. The traditional narrative way of documenting, in which each person has the ability to use their spoken language to document what they see in a way that they see fit, does not allow for easy retrieval, comparison, and measurement of data across settings. Limited ability to retrieve and use nursing documentation for research makes it impossible to show what nurses do and how nurses contribute to positive patient outcomes. And this, ladies and gentlemen, is a big problem. When we are unable to retrieve and compare documented nursing actions to patient outcomes, the valuable contribution nurses make to positive patient outcomes remain invisible. Previously, we discussed the need to move beyond gut feelings and towards using data to support our positions. It is not enough for nurses to say that they know that they contribute positively to patient outcomes. Nurses must be able to objectively show using data how what they do impacts the outcomes we see in patients. All of this will be possible when we are able to refer to the same thing in the same way so that it can be compared and measured. When nursing care is invisible, we are unable to say what it is, what it does it help, how much of it does a patient need, and how much does it cost. The invisibility of nursing care also negatively impacts our ability to plan for nursing services. Previously, we discussed the fact that we can use the time spent with patients as a way to classify how ill or how well a patient is, which will influence how many nurses are assigned to the ward on a particular shift. Nursing documentation does not adequately demonstrate what nurses do. It will be impossible for us to know exactly how many are needed to do what needs to be done. If we are unable to show what nurses do, we are also unable to demonstrate the value they add to the organization and how nursing actions help to reduce the ever-expanding cost of care. On the same point of cost of care, if we are unable to say what we do, it would be impossible for us to determine the cost of providing it on a day-to-day basis. Also, if we don't know what nurses do, we cannot design decision support systems to support nurses' decision making. Did you know that the nursing documentation in a patient's chart was removed from the patient's chart on discharge and then eventually destroyed? According to Huffman, as cited in Sewell 2019, in order to reduce the bulk and make the records less cumbersome to handle, many hospitals removed nurses' notes when the medical record personnel reassembles and checks the medical records after the patient has been discharged. The nurses' notes were then filed in chronological order in some other place that is less accessible than the current files until the statute of limitation expired. When the statute of limitation expired, the nurses' notes, the record of the patient's nursing care, was destroyed. This is a clear demonstration of the fact that the healthcare community at large did not recognize the importance of nursing data. Fortunately, today, nursing details are no longer purged and destroyed from the patient's record. Standardized nursing terminologies represents the light at the end of the tunnel of invisibility. They have played a significant role in unifying the way in which nurses document what they do. When data are documented in a uniformed way using standardized nursing languages, we are better able to use the data to uncover previously hidden contribution of nurses to positive patient outcomes. So, what are these standardized terminologies, you might be asking? In some areas, you will see them being referred to as controlled terminologies or interface terminologies. These are structured and controlled languages which were developed for the use within an electronic health record, but they can also be used in a paper-based documentation system. Standardized terminologies eliminates the variation in language by translating the clinician's common phrases into a uniformed expression which can be coded and used in an information system. Using these standardized terms allows the information system to record and exchange data with other information systems. Keenan defines a standardized nursing language as a common language readily understood by all nurses to describe nursing care. Standardized nursing languages facilitate measurement and comparison of nursing care and patient outcomes because standardized nursing languages eliminate the differences in expression which can occur when nurses document what they do in their own way. For example, if a nurse wishes to document that the patient has a pressure ulcer, the nurse could document by writing that the patient has a pressure ulcer, or that the patient has a pressure injury, or that the patient has a decubitus ulcer, or that the patient has a bed sore. Try to imagine the difficulty a nurse researcher would encounter trying to locate all patients with a pressure ulcer if they are looking for the same thing that is expressed in a different way. Let's talk about something that might be a little close to home. Think about why arborists refer to trees by their scientific names rather than by the names given to them by the man on the street. This is because the Bahia sapodilla, which is called the Aki in Jamaica, but in Guyana it's called the Guinepe. In the same way, using the scientific name for the Aki will make communication between arborists clearer, using standardized nursing languages to represent our nursing care will also make communication between nurses much easier. Now that we've cleared up what standardized nursing languages are and what they are used for, let's look at some examples. Listed here are some examples of standardized nursing languages used to document nursing care. In another video, I will go through each of the following standardized nursing languages in greater detail. Please pay close attention to NANDA, as it is the standardized language that you will use when you begin to write your nursing diagnoses. Also, pay keen attention to the ICNP and be able to recognize differences and similarities between what nurses do with this language to document compared to others. It is important for you to understand that the nursing minimum data set and the nursing management minimum data set are not standardized languages. What they are is an attempt to standardize the collection of data among all patients. In other words, they outline what types of data are to be documented on every single patient. So, while NANDA is a standardized language used for documenting the nursing diagnosis, the nursing minimum data set requires that for all patients, nursing diagnoses must be documented. So, we've come to the end of this segment, but before we close out, let's do a quick recap. Can you tell me what is nursing documentation used for? Please pause the video and formulate your response before you resume. Nursing documentation is used to measure healthcare outcomes, to communicate nursing care, and also for research. Give yourself some bonus points if you can say how nursing documentation is used in the ways above. Can you say what standardized nursing languages are in your own words? Again, pause the video, formulate your response before you resume. If your response used any of the words listed below to describe the manner in which nurses document their care, congrats, you're on the right track. Your definition should also include that this language is readily understood by all nurses. Can you identify 3 standardized nursing languages? You know the drill by now. Pause the video, formulate your response before you resume. If you listed any 3 of these standardized nursing languages, congratulations. If you listed all of these as examples, move to the front of the class. You're doing well. Please don't forget this one too. The nursing minimum data set and the nursing management minimum data set are not standardized languages. What they are is an attempt to ensure that the same types of data are collected on all patients. Last one, ladies and gentlemen. Can you explain at least 2 reasons why standardized nursing languages are important? Again, pause the video, formulate your response before you move on. Here are a few reasons why standardized nursing languages are important. If you were able to list 2, congrats, good going. If you were able to list 3, 4, or even 5 reasons why standardized nursing languages are important, well done. I'm so proud of you. Thanks for watching. Please feel free to use the comments to post any questions you might have. If there was anything that's not too clear, you can use the comment section for that as well. Remember, there's more coming, so tune in.